In 1972, about 30 of us were the local branch of the Campaign for Homosexual Equality, though we didn't dare call ourselves that. And at our Christmas dinner, we called ourselves the Canterbury Debating Society.
Growing up gay, lesbian, bisexual, trans can be a very isolating experience.
Many are isolated, and even now it's quite incredible how some people will say, I thought I was the only one.
I chose to go and live in isolation, but I'm also part of my HIV and dealing with Hep C treatment and whatever has also led to me having depression, suicidal thoughts, stress, anxiety, finding things daunting.
Do we isolate ourselves as trans people? I think we do.
In 1980, a group of us formed the East Kent Friend Telephone Helpline. We were terrified someone would find out where we were and vandalise the flat.
Stress and anxiety are commonly experienced across all 4 groups due to discrimination and marginalisation at school, in the workplace, from health services, from family.
I'm going to read you some quotes which I think from our participants which really highlight some of the issues that they're experiencing. The doctor had a very traditional, narrow view of transgender and felt that he could decide what gender I was after talking to me personally for 5 minutes. At the end, he explained that people didn't have more than one gender identity, so I must have something cross-dressing related and should be taken off hormones for a while to see how I settle down.
We still live in an age where there are stigmas and taboos which we need to break down.
The effects of homophobic bullying in schools is related to higher rates of depression, high rates of self-harm and high rates of suicide attempts among lesbian and bisexual young women.
Homophobically bullied a lot in school. I still sometimes see people that went to my school in the streets when I'm walking around Sheffield and they still shout abuse at me.
Nearly half of respondents have experienced either threats or harassment, and an alarming 1/4 of respondents aged 16 to 25 have actually experienced physical assault. %67% of lesbian, bisexual and questioning young women have hurt themselves on purpose, 67%, compared to 36% of gay, bisexual and questioning young men.
In terms of actual suicide, there was a 48% lifetime prevalence rate, with 11% prevalence rate in the last year. The most distressing finding that I kind of feel I really want to report actually is that 3.2% were actively planning to take their lives in the very near future. So there are people who filled out this survey who may not be alive today.
We always judge people, don't we? When we meet them, we judge them. And quite often that perception's very wrong. And I think we've all got to, I've learned to do it, you know, I've learned to not judge people, and it's hard. But I think we've got to give everybody a chance.
Addressing these issues, these mental health issues, and addressing them when people are young and maybe just coming out is so crucial to avoiding them having years of unhappiness and misery and perhaps more serious mental issues going forward.
The more we know about each other, the more we're prepared to support each other.
You must not let bigots get you down.